Hi everyone, welcome back to my channel. My name is Roda and I'm a doctor working in the UK, and today's video is all about the AKT, or the Applied Knowledge Test. This is one of the most important, most crucial exams in general practice training. For those of you who don't know, I'm a GP trainee. I'm in my last year at the moment, so I'm an ST3, and I've sat the AKT in 2018. So I thought I'll make a video to go through the A to Z of the AKT and what I actually did to help me score 91% in my exam. The reason I wanted to do this video is when it came to studying for the AKT, I found that there wasn't a single resource that actually put everything that I needed to know all in one place. So whether that's what resources to use, what the strategy is, how to revise, what to revise, where to get the information from, how to prepare. So I thought I'll make a video that goes through all of these things in much detail, and hopefully someone will find it useful. So let's get into it. I'm going to break this video into different sections, so I'm going to pop them all over here. So feel free to have a look around, and I'm going to be dropping the timestamps in the description below as well. Any resources, any information, any links, I'm going to be linking everything in the description box below again. So here goes. The AKT is one of two very, very important exams when it comes to GP training. One of the exams that you do need to pass in order to become a fully fledged GP. It tends to be sat in kind of ST2, so the second year of training. One of the most important things when it comes to tackling that exam is having a very clear strategy. Without a clear strategy, I would not know what I was doing, how to approach the exam, and any of that. So a strategy is really, really key. And because the content is so overwhelming and there is so much to cover, and a lot of the time you will be working when you're sitting the exam, there is as much importance in pre-planning and actually preparing for the exam as there is actually learning for the exam. But with the right preparation and the right resources and the right mindset, you will be able to pass it with flying colours. So the first thing I want to talk about is mistakes that people tend to make when it comes to the exam. And this is all anecdotal from friends and people that I know that have also gone through the exam. One of the main ones that I found is people only studying by doing question banks and not really referring to anything else in terms of notes or looking at any guidelines. The other thing is underestimating the exam. It is a really challenging exam. It's a long exam. It really requires a lot of sacrifice and a lot of commitment in terms of actually going through all the content. And the other mistake is people trying to memorize everything rather than just understanding the content. Yes, there are things that require pure memorization, but a lot of it is all about understanding it as well. Mindset is something that's so important. I do not want to go into that exam and being motivated by worrying about failing. So I kept telling myself every day, Rhoda, you're gonna be able to pass, you're gonna pass this exam. As long as you do the best as you possibly can, then you should be okay. And I guarantee you, as long as you've covered everything, you'll be absolutely fine. So the next one is pre-planning. So this is even before you put pen to paper. You really need to look at when you actually want to sit the exam. If you're doing a really busy rota, you might not want to do it during that time. You need to look at the dates to make sure that you're not on a week of nights, for example, when you're wanting to sit the exam. Sorting out all your annual leave, making sure that you got time off for the actual exam itself, and how long is the study period going to be lasting for you. For some people it might be a little bit less, some people it may be a bit more. For me personally, it was around 3 months. And the next one is preparation. I could not start studying until I knew exactly what I need to be studying, when I need to be studying, and for how long I need to be covering each speciality. So one of the first things is a lot of resources on the RCGP AKT website. So one of the first things I did was print off the AKT content guide. So this is a document that literally covers every single speciality and breaks down all the different diseases and conditions within each speciality. So the document is here, so it literally goes through everything, as you can see. So within each topic, so for example cardiovascular disease, it does go through all the specific conditions, so heart disease, diabetes, hypertension, coronary heart disease, hypertension, arrhythmias, congenital heart disease, circulation issues. So this is what really helped me figure out what my strategy was going to be, and looking at what it actually is that I need to be covering. So I printed off the whole document and then used that as a guide to make sure that I've covered everything. So I'd highlight everything that I completed. I also looked at the GP curriculum, which was really helpful in terms of making sure that it complemented the AKT content guide information. So again, this breaks it down into all the different conditions and exactly what you need to know. So it's really worthwhile having a quick glance through it, skimming through it, making sure that you get a flavour of what exactly is it that the AKT requires of you. So I had a look at the feedback statements on on the Royal College's website. So this is basically reports that they do for every single AKT exam that is sat, and then they look at what is the weaknesses that candidates have, what are they really good at. So I looked up maybe the last 5 years of reports. So there were things that were like a recurring theme of people not doing very well on an exam, and a lot of the time the places that people didn't do so well on tends to be the stuff that we're not taught or exposed to that much. So uncommon things that we don't tend to see a lot. So for example, chronic disease management, vaccinations, smears, gynecological type stuff. It's a really, really good way of tailoring revision. And now that I did all of that, it was time for me to make my timetable, which was probably the most important tool I had in my study kind of arsenal. A timetable really helped me break down the process so it's way less overwhelming, and it allowed me to incorporate kind of working hours, whether I was on nights, whether I was on weekends, how much I'm going to be covering on each given day. There's a lot of evidence that says that if you write things down, you're more likely to get through it. And when it actually came to sitting down to study, I made my timetable very specific. So on this day, I'll be doing atrial fibrillation, hypertension, and chronic heart failure, instead of just writing cover cardiology today. So then in that way, I've made it so specific so that I know exactly when I sit down, I'm going to be doing this today. So that was really, really important for me. The next one is strategy. You have to be strategic when it comes to this exam. So I'm going to be going through a list of things I wrote down on my notes so I don't forget anything. I made sure that I started with the core material first. So things that are common in GP. So that's things like cardiology, diabetes, hypertension, asthma, COPD. Those are the common conditions that we see a lot. And those are the topics that tend to come up in questions a lot as well. Pretty much guaranteed. There's no point with me starting with really niche and obscure topics. I'm not going to start with chemo medications or, paraneoplastic syndromes. So by the time it comes to the end of my study period before the exam, at least I know I've covered all the important and common conditions. And if I don't get time to finish all the other obscure stuff, then I know that that is going to be making a very, very small percentage of questions anyway. The other tip is how to actually go about studying. A lot of people will say, oh, I just did question banks or I just took notes. So for me personally, what I did was I split my studying based on each speciality. So I started with cardiology, so I would cover AF and then go through all of that, take notes on it. And then once I've covered the topic, I'll be doing questions specifically filtered around the topic that I've covered notes on. So there was no point me doing random questions right from the get-go when I've not even covered 95% of the curriculum, because then it just ends up being me memorizing the questions and answers rather than me doing questions to test my knowledge that I've learned. So for me, doing questions was definitely really important, but it didn't form the whole of my study process, if that makes any sense. And the next thing is incorporating active recall and spaced repetition into my studying. So active recall is shown to be the most effective way of retaining information and understanding it as well. So for example, active recall is doing questions, flashcards, explaining it to someone else. All of those test whether you've actually understood something and can remember it. So I'll try and explain that in practical terms of how I did that. So each week, so I'll cover a topic, for example, during kind of Monday to Saturday. Sunday, I will try and not learn any new content. So Sunday would be dedicated to revisiting the information that I have learned and took notes on. So that would be doing questions. I'll be utilizing something called a Feynman technique, which is basically where you're explaining it to someone else as if they were 5 years old. So that was the single best way of figuring out whether I've actually understood something. So I'll talk to my friends over the phone, or Skype, or sometimes face to face, and I'll explain, atrial fibrillation management. When I found that I couldn't explain it very well, that meant I've not learned the content properly. So I'd go back and make sure, recover my notes again, do questions around it, and then, try and explain it again. And that is where spaced repetition comes into. The mistake you can make is you cover something, you've took the notes on, you've done a bunch of questions, and then you forgot about it. You've not revisited it. There's something called the Ebbinghaus forgetting curve. So whenever we've learned something, if we've not revisited it, we quickly forget it. But if you revisit it at regular intervals, you're less likely to forget and you're more likely to retain it. So by the time it comes to your exam time, you will have remembered the majority of the information that you have learned. So spaced repetition is where you're constantly revisiting information. So that's by doing questions, explaining it, revisiting your notes, that type of thing. And the other thing is when it came to note taking, things that I knew had like a stepwise management, so things like COPD depending on the FEV1, hypertension depending on whether there's any target organ damage, I would put that in a flowchart that looks visually appealing, because I knew I was going to be referring to that quite often, because those are the topics that a lot of questions are around. So I'll give you an example of how that looks. Like COPD, you can see it. If you had a look at the NICE guidelines, it's like a wall of text, but I've just broken it down so it just looks a little bit more easy to actually figure out and see what's going on. Or, I don't know, what's this? Hepatitis, kind of the different antibodies. So you can see, again, I just broke it down. Just looks a little bit more easy. And when I knew I had to look at it again, it just looks much easier and I can refer to it quite quickly. So that was that. So the next one is resources. So the first one is question banks. Very important resources, and anything else that I found really helpful when it came to actually sitting the exam. The first one, in terms of question banks, I primarily used Past Medicine. I found it really useful. I found that that was the question bank that probably most reflected the actual questions in the AKT. It's really useful in the sense of giving you a lot of information when it comes to doing each question. So they'll refer back to guidelines, there's rationale for why the answer was correct or why it was wrong. And there's also a discussion element to it as well, where other people can comment. So I found that actually really helpful. The other question bank that I used was BMJ on examination. I only used that in the last month before the exam. The only reason I did that was just to get a flavour of a different way of questions being asked, because you get too used to doing the same kind of style of questions. Other question bank like past tests, I did not find particularly helpful. I felt like a lot of the questions were very esoteric, so I didn't find it reflected the exam as well as it can do. There's also the RCGP self-test. So I use that specifically as a pre-test questionnaire. So if I was covering cardiology, for example, I do the self-test questions around cardiology just to see how well I already know the topic and what am I weak in. So that kind of helped me tailor my revision, but it didn't form like the main kind of question bank, if that makes any sense. 14 Fish is also another kind of resource that I think Health Education England's invested in. I think the website can be a little bit of hit and miss. At the time I was doing my exam, it was pretty new, so there wasn't much in terms of content, but their admin videos are quite useful, and I did do the mock exam just before the exam as well, so you know, it's worth having a look at. So then this is very important resources that I personally felt that I wouldn't have passed the exam if I didn't use these resources, and that is NICE guidelines. You cannot pass the exam without referencing NICE guidelines. They specifically look at CKS, which is a more summarized version of the actual full NICE guideline. So I used the AKT content guide to kind of help me guide me through this. I split the specialities and put it into a bookmark. So when I was referring back to it, I'd made sure that I didn't forget anything. So for example, I don't know, psychiatry, I put in all the guidelines that are in that speciality, and it was just a nice quick way of referring to the source when I was taking my notes. So I found that really helpful. So, you know, psychosis and depression, so you can see it, they literally split it into background, diagnosis, management, and that was the majority of my note taking. Some people say, do I need to look at other guidelines? So for example, BTS, British Thoracic Society, or the SIGN guidelines, which is the Scottish guidelines. And the answer is, I think specifically for asthma, I did look at BTS/SIGN guidelines because they differ quite significantly from the NICE guidelines. So I just made sure that I had a look at those as well and knew what their stepwise management was. And I did find that in the exam, there was a question that suggested that you should know both of the guidelines. So that's a pro tip basically. The other resource that's really crucial is the BNF. The first 36 pages I just checked, I took notes on. This is really useful information, and I did see that there were questions that came up around this. Is it goes through things that you wouldn't necessarily find online. So for example, how to write a prescription. So it shows you the actual prescription, the FP10, so to show you what you actually need to include and what is correct when it comes to, for example, controlled drugs prescribing. I'm just flicking through this. Emergency supply of medications and how that is administered, knowing the different classifications of controlled drugs, you know, things like tramadol and morphine. It also tells you about the yellow card scheme, so how to report on side effects. And also very important is prescribing and palliative care. So there's a really useful section on morphine kind of regimes and what to prescribe for different symptoms when the patient is terminal. So I did that, and that is up to kind of page 36. And it's worthwhile highlighting and putting little sticky notes in common topics. So for example, for me, I've got diabetes, COPD, HRT, acne, and when it comes to the exam, then at least you've got this for reference and then you can have a look at it. And the other resource was the GP handbook. Again, I found this quite useful, especially for the admin type stuff, so kind of practice management. So again, that's probably the first couple of chapters as well, so it's worth just having a flick through that. And in terms of administrative stuff, so like practice management, so for example, how to deal with complaints, GP contracts, CCG, all of that stuff. But also what's really helpful is if you at a GP practice, it might be worthwhile having a chat with the practice manager, because they're the people who tend to know about all of that stuff. The other really useful resources is a DVLA website, so kind of any driving restrictions and criteria for general drivers and also heavy goods drivers, so whether that's diabetes, epilepsy, that type of thing. Other really useful website when it comes to flight kind of criteria, not that we can fly anywhere these days, is the Civil Aviation Authority. So it's really helpful. So like pregnant ladies, if you've recently had surgery, any of the major conditions like asthma, COPD, cancer, that type of thing. But I'll drop a link in the description below and just have a look. I wasn't in a general practice when I was doing my exam, but you are in a general practice. You tend to have tutorials with your supervisor. So this is a really useful way of getting your supervisor to teach you about things that you can't necessarily easily find online or in books. So not teach me about COPD or asthma, but more about the practice structure, you know, complaint process, CCG type stuff, GMC kind of ethics, that type of thing. And the other resource is portfolio. So this is the bane of our existence, but it was actually useful when it came to revising and studying for the AKT. So instead of me just reflecting on like a random kind of patient and just writing about, you know, what went well, what didn't go so well, I used my reflection as a way of actually studying as well. So for example, when I was on pediatric and I saw a patient with febrile convulsions, I would use that as an opportunity to just make sure I looked at the guidelines for febrile convulsion and then looked at what I actually did in practice and whether that matched. And in that way, I'm learning kind of by using real patients, and that's probably the best way of learning when it comes to medicine. So use your portfolio reflections as a way of revising for your exam as well. So the next one is the GMC website. This is really helpful for the kind of ethical side of stuff. So whether that's confidentiality, consent, capacity, end of life care, best interest, all of that stuff. So there's really little summarized booklets on the GMC website. So for example, confidentiality, how to prescribe, decision making, leadership and management, kind of maintaining professionalism, and they do definitely have questions around that. Children, young people, so for example, Gilead competence in contraception prescribing, can children consent for treatment, that type of thing. So if you click on it, decision making, you can see here it's really helpful. So for example, how do you assess capacity? So it's really underutilized resource that you can use as well. And the next one is courses. I personally didn't really go on that many courses. I only went on one actually. That was the RCGP AKT preparation course, which was run by the Royal College themselves, and that kind of went through the general format of the exam. And I think I went on that just to kind of reassure myself and familiarize myself with the nature of the exam and go through like stats and like the questions and how to go about answering and things like that. I know other people went on like eMedica and Aurora and those type of courses and found it really helpful. I haven't, so I can't really comment on those particular courses, so it might be worth something to look at. So the last part of the video is what I did kind of 7 to 10 days before the actual exam. The main thing is I did not learn any new content. By now, if you've kind of organized yourself really well, you should have gone through the whole kind of curriculum and content and be quite comfortable with having covered everything. So for the last week or so, I dedicated that time to revisiting things I knew I struggled with a lot and I kept forgetting. So that was doing questions randomly, revisiting my notes, explaining common conditions that I knew were going to come up, and making sure that you know the stepwise management of the major conditions inside out. Like you can reel that off without a pause, without a break, without a stutter, and just looking over things that require pure memorization. So for example, childhood immunization schedule, list of medications that are enzyme inducers and list of medications that are enzyme inhibitors. This is the time to also do things like mock exams. So I did a few kind of mock exams, not for the whole 3 hours, but for like an hour or so. So I did the 14 fish mock exam, did a few on the past medicine and the on examination as well. And yeah, so that's, I think I've rambled on for quite a little bit. Yeah, so that's everything. I hope you found that useful. This was a video I wish I had when I was approaching the AKT, and if it helps even one person, that's again a job well done for me. So if you found this useful and you took something away from it, please like the video, subscribe to the channel because it really helped me grow, and I'll see you in the next video.